How you doing, guys? This is Kento at Kamiyama PT. Welcome to this YouTube channel. So I want to talk something that's relatively implicit, meaning it's intuitive to a certain extent, but often difficult to do if you might be in this chronic pain pattern or stuck when it comes to your rehab or something in your life. I'm going to specifically talk about that from a movement perspective, and I'm going to try to keep it as simple as possible, maybe as casual as possible, because if I go too much into the nitty-gritty, I also get lost. So hopefully this will help, and I'll see you in the video. Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel. Okay, so I want to be as casual and relatable as possible, so it's a simple video. So if you are an analytical individual like myself, I like to analyze things quite well. It just gives me a feeling of control, but also a feeling of knowing, which is good for me. It feels like it's safe. However, at times, the information, I think the amount of information and the time of information that I have overwhelms my system. And what I also sometimes do is I overtake or neglect how I feel, especially from a movement perspective, how it feels to me in a movement perspective. And I try to push my logics that I learned from institutes or research into me versus the communication between how I feel and what does the research and information say and how can that integrate to my system. When I start to overanalyze and neglect my feelings, I start to have less communication, and I'm starting to build up on something where I might be pushing an ideal to myself while ignoring myself. And that has not helped me in the past. And what I've also found out that when we become very analytical or we're logic and we really start to figure things out through our mind, sometimes that turns off the intuitive, the bigger picture, emotion, how it feels to us. And that creates like a separation or a conflict within ourselves that creates the body saying no. So if you are experiencing something like this and you have a tendency to go, well, this institute said this way, while neglecting or not tapping into how it feels to you, I hope this tip is helpful, or my experience is helpful. So when I'm doing something and doing that, do I feel safe in this drill? Do I feel strong? Do I feel off? Do I feel like my heart's beating faster during these drills? My lung feels restricted. Do I feel my throat clogging up? Or does it feel weird in the gut? Like, these are feelings that you can tap into to help you know where you are, and then finding a way that maybe that could match up. And sometimes you don't. But your feelings, how it feels in your muscles or tension, or how it feels in your internal organs, that gives us a guidance or direction how it may work for you or for me. So I hope this is simple enough, relatable enough, and if you are tending to suffer or kind of stuck, I hope this is helpful, and I'll see you in a different video.